Hello everyone, welcome back. Am I audible and visible, guys? Okay, so I'm so sorry for the delay today. All right, okay. So without much ado, now as you all remember, yesterday we had left. Okay, yesterday we had left the session. Half of the PYQs we had done. All right, and the remaining half is still to be covered today. So we'll be talking about the remaining PYQs today. All right. So without wasting or talking too much, let's get on to the next question for the day. So I hope you remember the last question where we had stopped yesterday was question number 75. Okay, so are you all with me? Can I proceed? Okay, all right. So the question number 76 out. Okay, what is the answer to this? Registration of birth and death in national level is done by birth and death registration. Okay, who does the birth and death registration? Registration of birth and death is done by. What is your answer to this one? Registration of birth and death? Yes. Okay. So birth registration. Birth has to be registered within 21 days and death have to be registered within 21 days. Now here the question is not about birth and death. Okay. Here the question is mentioning, guys, registration of birth and death rate in India. So don't get confused. I have asked CBR and CDR. Okay. I'm asking you birth and death rates in India. Who is doing that? That is not civil registration system. Civil registration system, the responsibility is that the birth should be registered within 21 days and death should be registered within 21 days. यहाँ पे the question is CBR and CDR. CBR and CDR का responsibility किस पे है? It is under sample registration survey. Okay. If they had said birth and death should be registered within how many days? Okay, that is 21 days, CRS. All right. And CRS, remember, is the least efficient system. Okay, it is the least efficient health information collection system. Okay, but over here the question is birth and death rate. Okay, CBR and CDR का data कौन देता है? SRS. Okay, sample registration system. Also, one more point over here you should remember. It is which type of system? It is a dual recorder system. Okay, what is it? It is a dual recorder system. Okay, there are two types of, there's a part-time enumerator and there's a full-time enumerator. Dual recorder. Okay, and this SRS is the most efficient health information collection system. Also it gives us data on like CBR हो गया, CDR हो गया, okay, maternal mortality ratio हो गया, NMR हो गया, IMR हो गया. All right, also it gives you data on annual growth rates of a country. Okay, all that information is provided by SRS. What about NFHS? National Family Health Survey. Now remember, this has successfully completed 5 rounds. The last one was conducted in 2019 to 2021. Okay. Yes, SRS is done once every 6 months. SRS is done once every 6 months. But NFHS, everybody, is being done every 5 to 6 years. Okay, every 5 to 6 years. Also, NFHS is under the responsibility of International Institute of Population Sciences, IIPS Mumbai. Okay, IIPS Mumbai. Got it? Okay, and what does NFHS tell you? The data. It gives you data on like what is the prevalence of anemia in India, what about wasting, stunting, what about exclusive breastfeeding percentage in India, hospital deliveries. Okay, all those information, how many people are using internet, all those information is provided to us by NFHS. Clear? Okay, census, you all know 2021 ka census is still on way. It is the first ever digital census to be conducted. Okay, all right, going to the next one, guys, going to the next one question. The average number of children, so this is question number 77. Okay, average number of children a woman would have if she were to pass through her reproductive years, bearing children at the same rate as the woman in her age group. Now ये वाला question हमने कल discuss भी किया था. What is the answer to this, everybody? What is the answer to this? What will you tell me the answer to this? What is your buzzword over here? Very good, children. Okay, so we've already covered this question yesterday. अगर the buzzword is children, it is always total fertility rate. Okay, if the buzzword is girls, okay, if the buzzword is girls, it is gross reproduction rate. And what is net reproduction rate, guys? It is mortality dependent. Okay, mortality dependent. You can refer to yesterday's sessions. We have covered all the fertility indicators yesterday as well. Okay, all right. General fertility rate क्या होता है? It is nothing but total number of live births per thousand, not mid-year population, but women in reproductive age group. Okay, women in reproductive age group. General fertility rate is total number of live births per thousand women in reproductive age group. Okay. All right. Next question. Question number 78. See, it got repeated in August 2020. I mean, then it got repeated in 2021. What is the answer over here? Mortality is taken into consideration in. What is your answer? All these are PYQs. Okay, now we are doing topic wise PYQ. Mortality is taken into consideration. Very good, discussed many times. Net reproduction rate, this is also most sensitive indicator of achievement of family planning services. Most sensitive indicator of achievement of family planning services. Complete family size हो गया तुम्हारा TFR. Family size means the total number of children. Okay, all right, that was question number 78. Let's go to question number 79. What is the desirable TFR in India at present? Okay, now see, this was an old question of June 2021. Okay, if they ask you, what is the desirable TFR? Okay, desirable TFR क्या है? For any country, guys. Alright, what is the desirable TFR? It's not 2. India has now achieved 2. But what is the desirable TFR, guys? 2.1. Okay, current TFR, if anybody asks you, current TFR in India, all right, is of course 2. Okay, but for any country, okay, what is the desirable TFR? Please remember, desirable TFR is 2.1. That means we have achieved a 2-child norm. Okay, 2-child norm, and this is possible only when out of those 2 children, 1 is girl. So net reproduction rate is equal to 1, and this is possible when couple protection rate or contraceptive prevalence rate is more than 60%. Okay, is more than 60%. Clear? ठीक है, so don't get confused. Desirable, population stabilize होने के लिए desirable is 2.1. Okay, all right, moving to question number 80 for the day. At what point in time is the population assessed for calculation of crude death rate? That means when do you take mid-year population? I hope I'm not going too fast. The speed is okay for everyone. Okay. All right, I'm looking to wrap up in 1 hour. Okay, so that and then I will be sharing the compiled PDF for all of you. Okay, so what is the answer to this? Very good. Mid-year population is 1st of July. When do you take census stop? Anybody, if they can ask you mid-year population, they can ask you what is census stop. Census stop क्या होता है? Census stop होता है population count declared on. Like according to census 2011, the population of India was 1.2 billion. But when was it 1.2 billion? Okay, so that is census stop. Population count is declared on. Okay, it is declared on not 31st of March. No, it is declared on 1st of March. Okay, 0000 hours. Okay, so Nikhil got it correct, I think. Okay, that is 1st of March. Yesterday we had the first part. Ruby. Alright, first part आपको link में in the channel you will find it. Alright, चलो. Let's go to question number 81. Among the following, the first contact for people seeking medical care in a community is, what is your answer? What is the first contact for people seeking medical care in a community? Like suppose I come out from my house, okay, what is that first point of contact? Is it a primary health center? Is it a community health center? Is it a sub-center? Is it a district hospital? People seeking medical care in a community. Medical care तुमको सिर्फ PHC में मिलेगा? नहीं. PHC में it is the first point of contact with the doctor. Okay, if I wrote MBBS doctor. Okay, first point of contact with the doctor. If I wrote MBBS doctor, it is primary health center. But what is the first contact for people seeking medical care in a community? It is always sub-center. Okay, that's the first point of contact. What is the answer to this? It is sub-centers. Okay, all right. And suppose even before sub-center, whom would you encounter at the field? At the field, guys. Okay, at the field. Okay, whom would you encounter? You will encounter grassroots level workers. Okay, you will come across whom? Grassroots level workers. Okay, you will come across grassroots level. Asha, Anganwadi worker, alright, village health guide, trained birth attendant. Uska bhi question we are going to get. Okay, question number 82. This is question number 82. Tell me the question number 82. What is the answer to this? All of the following statements are true about a primary health center except, let's see if you can mark it. All are true about a primary health center except. Yes, what is your answer? There is one PHC per 30,000 population in plain areas. Type A PHC conducts less than 20 deliveries per month, provides maternal and child health care, family planning, and MTP. Okay, or is the first referral unit. Very good. It is not the first referral unit. First referral unit matlab once a medical officer sees and refers somewhere, that is the first referral unit. So what is the first referral unit? Community health centers. Okay, that is the first referral unit, community health centers. Now this we had discussed yesterday also. One PHC per 30,000 population in plain areas. What about hilly areas guys? One PHC yesterday भी हमने इसको डिस्कस किया था 20K population. ठीक है. Type A less than 20 deliveries per month. Okay, but what is type B? Type B is more than equal to 20 deliveries per month. Okay, everybody. ठीक है, equal to 20 deliveries is in type B. Now, do you have a type A and type B subcenters? No, you don't have a type A and type B subcenters. ठीक है, वो नहीं होता हमारे पास. Type A and type B subcenter नहीं होता है. ठीक है. Sorry, do you have a type A and type B CHC? No, that we don't have. We have a type A subcenter and type B subcenter. I'm so sorry. Type A subcenter है, वहाँ पे there is no delivery. Okay, and what is type B subcenter? There is yes delivery. Okay, but do you have a type A and type B CHC? No. ठीक है. All right. Okay. Moving ahead to question number 83 for the day. Let's see. What is the criteria for urban CHC? What is the criteria for urban CHC? Now, you also have a community health center, rural areas. You also have a community health center, urban areas. So, what is the criteria for an urban CHC? Tell me, for city with 1.5 to 2 lakh population, is it? Where sub-district, district hospital not present. Referral center for 2 to 3 urban PHCs or 100 bedded in metro cities. You remember कल मैंने आपको पढ़ाया था, if you talk about urban areas, okay, what is the healthcare delivery set up in urban areas? Now at primary level in urban areas, do you have subcenter? No, that was also one MCQ. You will never use the term subcenter in urban areas. Okay, so what was it at primary level? At primary level, you have a urban PHC and you have urban HWCs, okay, health and wellness centers. Health and wellness centers is a term which is given for the subcenters. Urban PHC कितने population के लिए होता है guys? 1 per 50 to 60K population, 50,000 to 60,000. All right, and if you talk about one urban health and wellness centers, which is like equivalent to a subcenter, so it is 1 per 15,000 to 20,000 population. Okay. Then at secondary level, what do you have everybody? Very good Puneet. At secondary level, very good guys. Urban CHC. Now here we had studied metro city के लिए, okay, and we had also studied non-metro city के लिए, okay, metro and non-metro. Metro city में कितना है? 1 per 5 lakh है. Non-metro city में कितना है? 1 per 2.5 lakh population. And then tertiary level medical colleges and SSH. So this is wrong. Now, even if you have a sub-district hospital and a district hospital, that doesn't mean you will not have a CHC. Or if you have a CHC, that doesn't mean you don't need a sub-district or a district hospital. ये भी गलत है. Is it referral center for 2 to 3 urban PHCs? No. Urban PHC 50 to 60. This is like almost 5. So it is 4 to 5 urban PHCs, not 2 to 3. 100 bedded in metro cities. I told you, metro cities में कितने बेड है? 100 बेड है. नॉन मेट्रो सिटीज में कितने बेड्स हैं गाइस? 50 बेड्स हैं. क्लियर? Done revision, everybody. Healthcare delivery system, of course, is an important question. So now we are looking at PYQs topic wise. Okay, all right. Come to question number 84. See, June 2021. What is the answer? In India's healthcare system, what are the first referral centers, guys? What are the first referral centers? Anybody? पहला referral क्या है? Is it the subcenter? Is it the PHC? Is it the CHC? Of course, the first referral center. Now, is it primary health center? No. Primary health center तो referral है नहीं पहला. ठीक है? It's the first level of healthcare. It's not the first referral. Now, medical college is not first referral. It's the second referral. Okay, district फिर भी है. Community health centers. Now community health centers is definitely the first referral, but what about medical college? वो तो second referral है. Okay, so what is your correct answer over here? Sub district hospitals and community health centers. Okay, sub district hospitals and community health centers. देखो guys, always remember one thing. There are 3 levels of healthcare: primary, secondary, tertiary. Levels of healthcare 3 है, ठीक है. बट क्वेश्चन मैं पूछ रही हूँ रेफरल सेंटर. First referral मतलब PHC से the doctor will look, and if he's not able to figure out, he'll send to a specialist. So CHC and sub-district hospitals. You're understanding? Okay. So first referral, what was the correct option here? Option D. Okay. If out of them you have to select one, community health center या sub-district hospital, तो आप क्या select करना? Community health center. Clear? Okay. Question number 85. All facilities are provided at a community health center except specialist present like surgeon, blood storage facility present, first referral units, genetic care intervention. क्या है इसका आंसर? All facilities are provided at a CHC. What is the answer to this? So see, sometimes they can ask you CHC के facilities, PHC के facilities. Okay, CHC में we have all the specialists, right? CHC में we have all the specialists, everybody. So look over here. CHC should have minimum 6 specialities. Okay, medicine, surgery, peds, obs, gynae, all the final year subjects. Anesthesia के बिना वो क्या ही कर सकते हैं? Anesthetist. I mean, obviously, but we need an anesthetist and opthal. ठीक है, 1, 2, 3, 4, 5, 6. These 6 they should have. Okay, ENT, dental. Okay, but minimum they should have these 3. Although we have, although we have ENT, we have a dentist. Okay, but still, and one ophthalmologist will be present up to 5 CHC. Now, guys, what is FRUs? First referral unit. Okay, now CHCs are upgraded to first referral units. Okay, for this we have 3 critical determinants. For any health center to be called as a first referral unit, you're going to have 3 critical determinants. This is very important. Okay, like what makes a center a first FRU? 3 critical determinants. Number 1, वहाँ पे blood storage facility होनी चाहिए, ठीक है? Blood storage facility, that should be provided. Number 2, we should have provision for emergency C-section. Okay, and also we should have provision for care of newborn. Okay, care of newborn. These make it like, other than of course pharmacist होना चाहिए, lab technician होना चाहिए, ठीक है, but 3 critical determinants to call it as a FRU. Please remember, blood storage facility, emergency C-section, and also we should have newborn का care possible. ठीक है? Yes, NICU. Okay, NICU, or you can say a newborn care corner. ठीक है, newborn. अब newborn care corner तो सारे labor rooms में है, whether it's a sub center or a PHC. We need to at least CHC में we need to have a newborn stabilization unit. Got it? Clear everybody? Ambulance वो सब secondary है. Critical determinants FRU के लिए ये 3 है. Got it? So what was your answer over here? Specialist होना है, blood storage होना है, first referral units. Okay. Genetic care intervention is not a necessary critical determinants. Okay. All right. Let's go to question number 86. All healthcare providers are working at village level except. देख रहे हो healthcare delivery system से कितने question आते हैं? I will be covering in short session. Today I will share a revised roster for short. Okay, this upcoming week's classes and when they will be taken. The time will be 2 p.m. only, guys, but 1 or 2 days might be here and there. So I'll share the new roster today. What is your answer over here? All of these are at village level. Village level means you have grassroots level workers. Okay, this is what grassroots level workers. Now please remember, इसमें हमें क्या क्या पढ़ना है? आशा, सबकी फेवरेट आशा, ठीक है, और फेवरेट आंगनवाड़ी वर्कर, ठीक है, विलेज हेल्थ गाइड, trained birth attendant. Now over here, what is your answer? ANM. Okay, over here your answer is ANM. See, ANM actually, where is she posted? She is a health worker female. What is her other name? Health worker female. Where is she posted, guys? Sub center. ठीक है, where is she posted? Sub center. So per se she is not a grassroots level worker, but then she has to visit the fields at regular intervals. Okay, she does visit the field at regular intervals. From here, of course, the option is ANM. Suppose you had another option. ठीक है, मान लो A दिया होता ANM, okay, B दिया होता LHV, C दिया होता TBA, D दिया होता आशा. What would you have marked now, guys? From these 4 options तुम्हारे आंसर क्या होते? ANM, LHV, TBA, आशा. अब क्या लगाते हैं आंसर में? Same question. All our health care workers working at village level. What would you have then put your answer as? Very good, guys. तब तुम्हारा आंसर हो जाता lady health visitor. Okay, who is a lady health visitor? Lady health visitor is a health assistant female. Okay, health assistant female. Now we have a health assistant female. We have a health assistant male. Where are they posted? ये लोग कहाँ posted है? पर से primary health center में. तो यहाँ पे out of the options you would say that okay, ANM does visit the field at regular intervals, but यहाँ पे your answer became ANM. Here your answer became LHV. Got it, everybody? Okay, so be careful with the question. But anybody asks you, name the grassroots level workers, they are none other than ASHA, आंगनबाड़ी worker, village health guide, train birth attendant. ठीक है, समझ आया? thumbs up everybody, समझ आया? Okay, going to question number 87. चलो बताओ. Jan 2023. Eligible couple registered are maintained at which of the following centers? Eligible couple register. Every year you'll get it. Yesterday we had discussed the latest July 2024 questions also that are already covered. Please do check out the last day's session. Sunday, Monday दोनों का session एक साथ करना है, ठीक है? PDF आज share करेंगे. Answer दो, very good. Eligible couple registered maintained at subcenter. Now guys, one or two questions from eligible couple. कौन होता है eligible couple? Please remember, eligible couple are married couples. Okay, married couple. All right, reproductive age group in need of family planning service. We will never say unmarried couples. You can have a 20-year-old woman who's unmarried. We'll not count her as eligible couple. Eligible couple का criteria है married couple, reproductive age group. ठीक है, reproductive age group. Married couple in which age group? Reproductive age group. Okay, reproductive age group 15 to 49. Now please remember one more important thing over here, that they can be newly married or they can have 2 to 3 children. That doesn't make a difference. Earlier we used to have the term target couple. ठीक है, target couple no longer used. Target couple is no longer used. Remember this. Okay, target couple क्या था? Eligible couple with 2 or more children. Okay, 2 or more children. Earlier we thought that family planning was only needed for people who have 2 or more children. क्यों? Newly married couple also needs family planning. All right, you should delay the birth of the first child by at least 2 years after marriage. And what should be the gap between 2 pregnancies? At least 3 years. इसीलिए target couple term हट गया. We only have eligible couples now. It is married couples in reproductive age group in need of family planning services. Okay. One more question. How many do we have? 150 to 180 eligible couple per 1,000 population. ठीक है. And where is the eligible couple register maintained? It's maintained at the center. And who has been given the responsibility to maintain this? It is responsibility, okay, is lies with ANM. Please don't say multi-purpose worker male. No, primary responsibility of ANM multi-purpose worker female is to maintain the eligible couple register. ठीक है, ANM का और क्या फंक्शन है? हीमोग्लोबिन एंड यूरिन टेस्टिंग. ठीक है, हीमोग्लोबिन एंड यूरिन टेस्ट यही करती है. ठीक है, डिलीवरी यही करती है, कॉपर्टीज ये लगाती है. ठीक है, ऑल राइट. व्हाट इज द फंक्शन? लेट मी डिस्कस वन मोर क्वेश्चन ओवर हियर. व्हाट इज द फंक्शन ऑफ मेल मल्टीपर्पज वर्कर, गाइज? सो वी ऑल नो मलेरियल सर्वेलेंस. ओके, वी ऑल नो इट इज मलेरिया सर्वेलेंस. ओके, प्रिपेयर मलेरिया स्लाइड एवरी fortnightly from suspected fevers cases. All right, chlorination. Okay, chlorination. And of course एक और है guys, collects sputum samples. Okay, collects sputum samples. Malaria surveillance collects sputum samples. Got it, everyone? चलो, question number 88 पे आ जाओ. Question number, this is not this, question number 88. December 2021. The minimum requirement of a health worker job are given. Should be a woman, a resident of the village, 25 to 45-year-olds, formal education till 10th standard. Who is she? Who is she? She is none other than, who is she? Very good, she is Asha. ओके, आंगनवाड़ी वर्कर भी याद रखना 10th पास होती है. ठीक है, 10th पास होती है. एंड आंगनवाड़ी वर्कर, यू शुड रिमेंबर 10th पास, शी गेट्स, आशा वर्कर को कितने डेज ट्रेनिंग है? 23 डेज ट्रेनिंग है. ठीक है, आंगनवाड़ी वर्कर पर से आईसीडीएस प्रोग्राम की मेन मेंबर है. ओके, आईसीडीएस प्रोग्राम की मेन मेंबर है. लाइक शी इज रिस्पॉन्सिबल फॉर रनिंग द आईसीडीएस प्रोग्राम एट आंगनवाड़ी सेंटर्स. एंड आंगनवाड़ी वर्कर का ट्रेनिंग पीरियड कितना है? 4 month ट्रेनिंग. ओके, okay, 4-month training. Multi-purpose worker, male and female, they have to be 12th pass, okay, and they have a 12-month training, okay, 12-month training. Multi-purpose worker, male and female कहाँ पे posted है? सब centers में. 12th pass, 12-month training. Die is no longer used, she is a TBA, okay, trained birth attendant, okay, she is a trained birth attendant. Trained birth attendant, village health guide, okay, TBA, VHG, दोनों का पॉपुलेशन नॉर्म है 1/1000 पॉपुलेशन, ठीक है. ट्रेन बर्थ अटेंडेंट को ओनली 1 मंथ ट्रेनिंग देनी है, नो एजुकेशन नीडेड. विलेज हेल्थ गाइड हैज़ टू बी 6th पास, ओके, एंड 6 का आधा 3 मंथ ट्रेनिंग, ठीक है, 3 मंथ ट्रेनिंग. गॉट इट? Okay, all right, okay, everybody know. Anganwadi worker as well as Asha 10th pass. This I've written all about the Asha workers, you can go through it, okay. 25 to 45 years, married or first, okay, married, divorced, okay, whatever, that's okay. Selected by village panchayat, accountable to village panchayat. Training duration 23 days. Trained by ANM Anganwadi worker, 10th pass. Existing population of 1/1000, proposed is 2/1000, and she is any grassroots level worker is an example of community participation. And what is the what is the main responsibility? इसका काम क्या है guys? रोल एंड रिस्पॉन्सिबिलिटी देख लेना. शी इज अ मोबिलाइजर. मोबिलाइजर. नो, आशा इज नॉट 8th पास, प्लीज रिमेंबर. 10th पास फॉर आशा, ओके, चाहे वो प्लेन एरिया में रहे चाहे वो हिली एरिया में रहे. इज इट क्लियर एवरीबडी? आशा का एजुकेशनल क्राइटेरिया कितना लोगे? 10th pass. 10th pass, I'm repeating it again, okay, 10th pass. And she's a main responsibility is mobilizer of the community, okay. And look at this, community household toilets भी है, construct करने में मदद करती है, ठीक है, okay. Question number 89 for the day. In rural areas, one ASHA worker is assigned for a population of, see, topic wise, so many questions from healthcare delivery system. We all know rural areas ASHA worker is assigned for a population of 1/1000. That's the existing norm. And what is the proposed norm? Proposed norm जो है, that is how much? Proposed norm is 2/1000, but existing of course is 1/1000. Okay. All right. Question number 90 for the day. Let's see if you can do it. Very, very nice question, and it keeps coming in all the exams, guys. The pregnancy test kit launched by Government of India December 2021 में आया था. These are old things, but yes, you should know. निश्चय. Nikusht is web-based portal for surveillance of leprosy patients. Okay, for surveillance of leprosy patients. This is Nikusht. Web-based portal for surveillance of TB patient, Nikshay. Akshaya na एक TB के लिए program है guys. You don't have to get into that, but Akshaya is one of the program that is running for TB. All right, this is Nikshay. Okay, this is Nikshay. All right, this one. This is your Nikusht. Okay, this is your Nikusht, and of course, this is your Nishchay. Also, one more update. Although I will be having an update class, but over here only I'll tell you. I hope you all remember this. Nikshay Poshan Yojana. सबको याद है? Nikshay Poshan Yojana सबको याद है? Yes. What is the nutritional incentive under Nikshay Poshan Yojana now? It has changed. Rupees. पहले क्या था? 500 per month. Now it is how much? Rupees 1000 per month का nutritional incentive. Okay, nutritional incentive. It has changed, Dr. Rohit. It has changed. Nutritional incentive rupees 1000 per month मिलेगा to all notified TB patients. Okay. All right, so that was question number 90. Let's go to question number 91. What is your answer here? All of the following are pillars of primary health care except प्राइमरी हेल्थ केयर का पिलर. बताओ इसका आंसर. होगी सोनल. आई विल बी पुटिंग आउट अ न्यू रोस्टर फॉर दिस अपकमिंग वीक. लास्ट वीक के क्लासेस तो हो गए, सो उसी में आई विल डू इट. ओके. Alright, all the pillars of primary health care. Is it health education? Not at all. Yes, health education is entirely a different thing. Intersectoral coordination, appropriate technology, equitable distribution, और एक और क्या है guys? Community participation. Okay, what is it? Community participation. Community participation. Community participation का example क्या है? Grassroot level workers. Okay, grassroot level workers like ASHA, Anganwadi, ANM, all of that. Appropriate technology. Cost effective good quality services. ORS is an example of appropriate technology. Shakir Step. Okay, Shakir Step is an example of appropriate technology. ठीक है. उसके बाद तुम्हारा वैक्सीन का हीट एक्सपोजर चेक करने के लिए क्या है, वैक्सीन वेल मॉनिटर, ठीक है, ये सब किसका है, अप्रोप्रिएट टेक्नोलॉजी, क्लियर, ऑलराइट, ओके। देन केएमसी, कंगारू मदर केयर, अप्रोप्रिएट टेक्नोलॉजी। Okay, question number 92, बताओ, best way to plot the trends in the incidence of diarrheal diseases in a given area, incidence, जून 2022 का क्वेश्चन है, इंसिडेंस, इंसिडेंस बढ़ सकता है घट सकता है, दो इंसिडेंस के लिए लाइन डायग्राम, हिस्टोग्राम, ओजाइव ट्री डायग्राम, व्हाट इज योर आंसर, line diagram. I've always told you line graph is something which will tell us the trends of an event, okay, trends of an event, like incidence of a disease can increase, can decrease, okay. So this one everybody is a line diagram, okay. What is this, this one is a line diagram, this tells us about trends of an event or a disease, it can increase, it can decrease, okay. But there were few other terms, histogram अभी दिखाएंगे, histogram is frequency of continuous variables, ogive, ogive is what, ogive is cumulative, ओके, ओजाइव इज व्हाट, क्यूमुलेटिव, यस, ओजाइव, ओजाइव का दूसरा नाम क्या है, एनीबडी, फ्रीक्वेंसी इज हिस्टोग्राम, फ्रीक्वेंसी ऑफ विच वेरिएबल्स टॉपिक, फ्रीक्वेंसी ऑफ कंटिन्यूअस वेरिएबल्स, ओके. सो क्यूमुलेटिव, या क्यूमुलेटिव फ्रीक्वेंसी कर्व, ऑलराइट. सो व्हाट इज ओजाइव, क्यूमुलेटिव फ्रीक्वेंसी कर्व, ऑलराइट, क्यूमुलेटिव, बेसिकली क्यूमुलेटिव मतलब यू कीप ऑन एडिंग, ओके. सो इट इज अ वेरी गुड constant increase, there is no dip in the number of cases, so it is for recurrent cases, all right. And there is one more, tree diagram. See, tree diagram helps you make decisions. Suppose there's a person who suffers from osteoarthritis, now I'm planning, diabetes, has osteoarthritis, I'm planning a surgery, so it's like we will make that, what are the possibilities if we do a surgery in that, okay, in him or her, all right. So it's drawn to come to the best possible decisions, okay. All right. Question number 91, देखो, जून 2021 में आया. What is the answer to this, everybody? The following diagram charts the population change over years from 1983 to 1989. What is the statistical diagram used for? What is the name of this, guys? Now, I've always told you, today we also had a class of biostat, okay, now on Prep Ladder. You can check it out, okay? Now, I've told you gap. Gap, यहाँ पे gap दिख रहा है ना? Okay, is it joint columns? No. Here, how are the columns? Distantly placed columns, okay. Distantly placed columns. Distantly placed columns means they have a gap. Now, gap, everyone, is a 3-letter word. Bar, everyone, is a 3-letter word, okay. And in the same bar, 1983, we have divided it into different parts. So, what is the answer to this? Component bar. Multiple bar क्या होता है? Multiple bar. Multiple bar होता है that I showed you. It's like something like this, then gap, okay. It's like gap between multiple bars, okay. Whenever you'll have a gap, it is this. And bar diagram, we all know these represent what? Frequency of frequency of qualitative variables. Qualitative means which variables, guys? Discrete variables, okay. Frequency of discrete variables, all right, okay. Now look at this one, question number 92 आओ, इसको देखो. Following type of representation of data is used for which kind of variable? August 2020. What is the answer to this? Which type of variable is this used for? Now you can see over here, do you have any gap? No. Here we don't have any gap. No gap. Okay. So what is it? Is it distantly placed columns? No. Here you have joint columns. Okay. Joint columns. There is no gap. No gap means हिंदी में अगर बोले कि कोई गैप नहीं है, no gap मतलब का क्या हो गया इसका? लगातार. लगातार का इंग्लिश क्या होता है? लगातार का इंग्लिश होता है continuous, okay. There is no gap, so it is लगातार. So what is the meaning of that? Continuous, okay. So which type of data is it used to represent, everybody? This is none other than histogram. Histogram is used to represent what? Frequency of which variables, everybody? Continuous variables. Continuous, or in other words, quantitative variables. Always remember, histogram, joint columns. Gap is a 3-letter word, bar is a 3-letter word, okay. Bar is for discrete variables, histogram is for continuous variables, okay. All right, question number 93, give me an answer. December 2021 का question है, बताओ. In a normal curve, what is the percentage of distribution that falls within one standard deviation of the mean? What is your answer? So we all know for a normal distribution curve, this is the midpoint. Okay, now this is the point of coincidence. At point of coincidence, mean is equal to median is equal to mode. Okay, mean is equal to median is equal to mode. Now, if mean is equal to median is equal to mode, and if that is equal to 0, okay, if that is equal to 0, you will call it as what? You will call it as standard normal curve. Okay, standard normal curve. So for a normal or for a normal standard normal curve, your mean is 0. Okay, this is what? Mean is equal to 0. And what is the measure of dispersion? One of the most commonly used measure of dispersion is standard deviation. So here 0.5, I'll 50% above, 50% below. So 0.5, 0.5. So what is the total spread of data over here? Standard deviation is 0.5 plus 0.5. So that is 1. Okay, so what is the total spread of data? 1. And what is area under the curve, guys? Area under curve is also 1. ठीक है? एक तो FMG एग्जाम में ये आता ही है, नीट PG में भी आता है, mean 0, standard deviation 1. Then if we drop like 3 lines over here, okay, although these lines would appear very far, they are actually very close to each other. Okay, so the first line, which is let's say green color, that cuts the base at 1 standard deviation on either side. Okay, so what you have to write over here? Mean plus minus 1 HD covers 68% observations. Okay, mean plus minus 2 SD covers 95% observations, and mean plus minus 3 SD covers 99% observations. Okay, remember this. Direct भी आ सकते हैं, you can get a calculation also. Mean का value दे देंगे, standard deviation का value दे देंगे, और पूछेंगे what values lie between, you know, what values lie between within 95% observation. So you should know this formula. Okay, all right. Coming to question number 94. Let's see if you can do it. In the urban area of Delhi has 4,000 population with different religions. Okay, with different religions. With different religions. Now, the research is being done to study the dietary habits of the population. Which of the following techniques can be used to obtain a study sample? Thank you, Anuj. Although we will be revising biostats once again for our FMG exams in short sessions also. Okay, but those who want to revise biostat, you can refer to Prep Ladder YouTube today. I've taken a biostat class at 12 p.m. Okay, it's like an overview of biostat MCQs, so you can go through that as well. Okay, if you're running out of time. Okay, all right. अब यहाँ पे देखो different religions. Different religion means that is a very big word over here. It's a buzzword. Different religions. So now what you can do, if there's religion X, you can divide it into one group. Okay, religion Y, you can divide into one group. Religion Z, you can divide into one group. Now you can study dietary habits in each of this. So different religions, that means you're dividing it into different stratas. Okay, stratified random sampling. If you have different religions, you can divide it into different groups, and then you can study the dietary habits in each of those religions. Okay, now let me just give you some buzzwords for your exams. Okay, let me just give you some buzzwords for your exams. Okay, I'm going to take up that question, Rahul. Let me finish all the questions that are pending. Then I'm going to take up that question that you're asking. Now look over here. Systematic sample. Okay, system. First look at simple random. Simple random sampling किसके लिए होता है? It is always done for a homogeneous population. Okay, it is done for a homogeneous population means everybody is similar. Like I have a group of university students with me. Okay, and I have a list. ठीक है? All right, where you have a sampling frame available with you. You have a sampling frame. Sampling frame matlab you have a list of students. You have a list of individuals. So in a college, if I have to do, I can do a simple random sampling. अब मान लो मेरे पास कोई population है जहाँ पे mix of people है. All right, heterogeneous. It's a huge sample. Okay, heterogeneous population. Okay, huge population. All right, and I can't convert it into different stratas. So what I will do? Systematic sampling. sampling. This buzzword will be what? Every kth or nth individual selected. Okay, every kth or nth individual selected. Or you would say sampling interval. ठीक है, sampling interval. Sampling interval अब जैसे यहाँ 1 to 3 आप किसको उठा रहे हो? Every third. तो एग्जाम में ऐसे ही क्वेश्चन आएगा, every 10th person selected, every third person selected, every 5th person selected. So वो किस टाइप का सैम्पलिंग है गाइस? सिस्टमैटिक रैंडम सैम्पलिंग. ओके, व्हाट इज दिस? स्ट्रैटिफाइड रैंडम सैम्पलिंग. दिस इज द बेस्ट सैम्पलिंग. ओके, and cluster random sampling. Cluster random sampling is easy, but then it has a lot of sampling errors associated with it. But as of now, you have to remember, since exam is very near, if you want to look at the immunization coverage, all right, or if you want to look at the ANC coverage, okay, we can go for which types of sampling? Cluster random sampling. ठीक है, stratified में सबसे अच्छा इसलिए होता है ना, क्योंकि you know if the population has more blue colors in the sample also, it will have more. If population has more green colors in the sample also, it will have green more. जैसे यहाँ पे 6 थे, यहाँ पे 9 है, so sample में I'm taking up 2 greens, okay, and यहाँ पे sample में I'm taking up 3 blues. Okay, so adequate representation of the population happens in stratified sample. ओके, क्लियर हो इट? एवरीबडी गॉट इट? ठीक है, यहाँ पे तुम्हारा बजवर्ड क्या था? डिफरेंट रिलीजन्स. सो व्हाट कैन यू डू फॉर दैट? स्ट्रैटिफाइड रैंडम सैम्पलिंग. ओके, okay, question number 95. Let's have a look at some nutrition question. Okay, can you just solve this? Just a second. Just 1 second, guys. Okay, what is your answer to this, everybody? What is your answer to this? Very good. An underweight adolescent girl is found to have the following finding. What is the WHO finding? What are you writing? Now, can you see? Okay, let me see your answers. A, P, B, कहाँ से? B, bite dot spot दिख रहा है क्या इसमें? Can you see that superficial? Can you see a slightly raised area? Can you see yellowish kind of this thing? No. This is what? This is a pure image of X1A. Conjunctival xerosis. Okay, conjunctival xerosis. Not everything is bite dot spot, guys. So please remember this one, and remember till here it is reversible. Okay, till here it is reversible. These are irreversible. Okay, these are irreversible. Also, guys, what is the most common symptom, guys? What is the most common symptom? Most common symptom is night blindness. Most common manifestation is night blindness. But what is the first sign? Okay, this is the first sign. That is conjunctival xerosis. And which one are you taking as the epidemiological marker? You can take bite dot spot, night blindness as the epidemiological marker. Okay, now night blindness ka prevalence, if it is more than 1%, okay, among 6 months to 6-year-old, ये आता है. Okay, we'll just revise night blindness more than 1%. Then vitamin A deficiency is a public health problem. Okay, yeah. And what about bite dot spot ka prevalence? If it is more than 0.5% among 6 months to 6 years, then again that is a public health problem. Okay, that's true. Yeah, bite dot spot and आशा, something that keeps coming very very often. Okay, पर हर चीज़ का आंसर आशा नहीं होगी. हर हेल्थ केयर डिलीवरी सिस्टम के हर क्वेश्चन में आंसर आशा नहीं होगी. ठीक है, ध्यान रखना इस बात को. ओके, चलो, ऑल राइट. मूविंग टू द नेक्स्ट क्वेश्चन फॉर द डे. सो दिस वाज 95 क्वेश्चन. लेट्स कम टू क्वेश्चन नंबर 96. ओके, व्हाट इज योर आंसर ओवर हियर? Which vitamin deficiency causes xerophthalmia? Very easy, but then yeah, we got it. We all know it is vitamin A. Xerophthalmia is dry eye. Okay, all right. Vitamin A. Richest source of vitamin A is halibut fish. Okay, halibut fish. All right, which halibut fish is also the richest source of vitamin D. Okay, going to the next one. More important over here is the preventive and treatment doses. कल भी हमने ये क्वेश्चन किया था. चलो बताओ. An 8-month-old baby on examination shows signs of vitamin A deficiency. What is the dose to be administered? Now December 2021. He shows, मतलब विटामिन ए डेफिशिएंसी उसको है, बच्चे को है, तो आप क्या करोगे? वेरी गुड. यू ऑल नो दैट इफ इट इज, एंड सो हियर आई एम आस्किंग यू नॉट अबाउट द preventive dose. I am asking you about the treatment doses. Okay, so we have it among 6 months. Okay, 6 months to 1 year. All right, 6 months to 1 year, and also over 1 year old. ठीक है। अब डे 0, डे 1, डे 14, डे 0, डे 1, 14, ऑल राइट, यू कैन ऑल्सो से डे 1, डे 2, डे 14, दैट्स ओके। Up to 6 months, how much dose do we give? 50,000 international unit. 50,000, 50,000. 6 months to 1 year, ये कितना डोज हो जाता है गाइज? 1 lakh international unit, 1 lakh, 1 lakh. More than 1 year कितना हो जाता है? 2 lakh international unit, 2 lakh, 2 lakh. Okay. Now remember one thing, you can also be said कि यार you could also be said ki in vitamin A deficiency, are we giving 2 doses on 2 consecutive days? Yes. All right, 2 doses on 2 consecutive days, wo bhi sahi hai. Okay, 2 doses on 2 consecutive days, that's also a correct way of saying. And remember all this are oral doses. ठीक है, यहाँ पे कितने महीने का? 8 महीने का है, तो 1 lakh international unit orally. ठीक है, ऑल राइट एवरीबडी। ठीक है, केजी का इंपॉर्टेंस सैम चाइल्ड में होता है। ठीक है, अगर हमारे पास लेस देन 8 kg से कोई बच्चा कम है, देन 50,000 दे सकते हो। उसके ऊपर है, देन वी कैन गो फॉर 1 lakh इंटरनेशनल यूनिट। ओके, ऑल राइट, सो दैट इज क्वेश्चन नंबर 97। टेल मी क्वेश्चन नंबर 98। चलो, क्वेश्चन नंबर प्रोफाइल एक्टिव टॉपिक वी हैव डिस्कस्ड मेनी टाइम्स। 9 months में 1 ml और 1 lakh इंटरनेशनल यूनिट, देर आफ्टर एवरी 6 months till 5 years of age 2 ml और 2 lakh इंटरनेशनल यूनिट। नाउ दिस यू ऑल नो, डायरिया, डिमेंशिया, डर्मेटाइटिस, रैश, एक्सपोजर टू सनलाइट, सबको पता है, नियासिन डेफिशिएंसी। ओके, एंड अनदर पॉइंट ओवर हियर गाइज, यू सी इट अमंग विच ईटर्स गाइज? You see it among maize eaters. Okay, maize eaters. Also you see it among jawar eaters. ठीक है, jawar eaters. ठीक है, now you all know maize eaters and jawar eaters, limiting amino acid तो है tryptophan, but then tryptophan gets converted into niacin. Okay, ऑल राइट, ठीक है, 60 मिलीग्राम ट्रिप्टोफैन 1 मिलीग्राम नियासिन देता है। ठीक है, ये भी पता होना चाहिए। बट हाँ, मेज ईटर्स में इज इट ट्रिप्टोफैन डेफिशिएंसी? नो, इट इज एक्सेस ऑफ ल्यूसिन। ओके, इट इज एक्सेस ऑफ ल्यूसिन, दिस प्रिवेंट्स द कन्वर्जन ऑफ tryptophan into niacin. Okay, now see how the other time the question came. Question 99. Okay, identify the deficiency. This image came, rash and diarrhea since 2 months. This is a characteristic finding. This is what Castle's necklace. Okay, this is Castle's necklace. What is this? Niacin deficiency. Okay, all right. ठीक है, ओके, लेट्स गो टू क्वेश्चन नंबर 100, Jan 2023. See, they gave a very basic question. Which of the following is not a trace element? Anybody? Which of the following is not a trace element? Which of the following is not a trace element? Copper, zinc, calcium, selenium. ठीक है, कौन सा trace element नहीं है? Which of the following is not a trace element? ओके, वेरी गुड। सो आई जस्ट टेक यू टू द बेसिक वन। सी गाइस, हमेशा याद रखो, मैक्रोन्यूट्रिएंट्स होता है। ठीक है, मैक्रोन्यूट्रिएंट्स। ओके, मैक्रोन्यूट्रिएंट्स अप्रॉक्सीमेट प्रिंसिपल्स। ओके, दैट इज प्रोटीन्स, दैट इज फैट्स, दैट इज कार्ब्स। ओके, दैट इज कार्ब्स। फिर होता है माइक्रोन्यूट्रिएंट, जिसमें मिनरल्स एंड माइक्रोन्यूट्रिएंट्स इज मिनरल्स एंड विटामिन्स। नाउ मिनरल्स में यू हैव अ मेजर मिनरल कैल्शियम, फॉस्फोरस, एक साथ चलता है, सोडियम, पोटेशियम, मैग्नीशियम। Okay, all right, trace elements, they are required in very less quantity. Okay, they are trace like, but they are very important for MCQs. like iron बहुत important है MCQ बेस के लिए, आयोडीन, फ्लोरीन, जिंक, ये तो आना ही है। ठीक है, 3 कॉपर है, कॉपर को आई मीन 3 सीज है, कॉपर, कोबाल्ट, क्रोमियम। ठीक है, मैग्नीशियम इज अ मेजर मिनरल, मैंगनीज इज अ trace element. Okay, and you can also remember one, selenium. ठीक है, but you will remember the major minerals guys. यहाँ पे क्या पूछा था? not a trace element, so it is calcium. कैल्शियम, फॉस्फोरस एक साथ, सोडियम, पोटेशियम एक साथ, मैग्नीशियम। ठीक है, एंड इफ आई से ट्रेस एलिमेंट, दे आर नीडेड इन वेरी लेस क्वांटिटी, बट देन फॉर एमसीक्यूज दे आर वेरी इंपॉर्टेंट। आयरन पे क्वेश्चन हमेशा आता है, आयोडीन पे क्वेश्चन आता है, जिंक पे क्वेश्चन आता है, फ्लोरीन पे क्वेश्चन आता है। इसके अलावा कॉपर, क्रोमियम, ठीक है, सिलीनियम। गॉट इट? चलो, okay, let's go to question 101 everybody. What is the answer to this? Question 101. The incisors of a child who had white patches on them later turned brown due to excessive supplementation of which of the following? The incisors, mottling of the upper incisors of the teeth. What is the answer over here? What is the answer of the year? This is very good, fluorine. Okay, what is the answer? Fluorine. Guys, you have to excuse me. ओके, सो व्हाट इज दिस आंसर? वेरी गुड, दिस इज फ्लोरीन. नाउ फ्लोरीन का एक और क्वेश्चन पहले देख लेते हैं. देखो, इट केम इन जून 2021 ऑल्सो. ओके, व्हाट इज द आंसर टू दिस एवरीबडी? What is the answer to this? A 45-year-old man living in Nellore, Andhra Pradesh. That was your very big hint. Presence with the following lesions on his teeth. What is the most likely diagnosis? Very good, fluorine. Now you all know, I'll just take you to the this thing. Normal fluorine का पानी में content कितना होना चाहिए? Normal fluorine, okay? Normal fluorine level is 0.5 to 0.8, okay? 0.5 to 0.8 milligram per liter. Now this is mottling of the upper incisors. This is dental fluorosis, okay? This is what? Dental fluorosis. यहाँ पे फ्लोरीन का कंटेंट कितना है? 1.5 मिलीग्राम पर लीटर. ओके, व्हाट अबाउट स्केलेटल फ्लोरोसिस? व्हाट अबाउट स्केलेटल फ्लोरोसिस? स्केलेटल फ्लोरोसिस में फ्लोरीन का लेवल कितना है? इट इज 3 to 6 मिलीग्राम पर लीटर. एंड व्हाट अबाउट क्रिपलिंग फ्लोरोसिस, गाइस? व्हाट अबाउट क्रिपलिंग फ्लोरोसिस? Yes, over here we've done in nutrition also more than 10. Okay, crippling is more than 10. All right. Yes, fluorine is a double-edged sword. Okay, excess is also a problem, deficiency is also a problem. Okay, this one right here is fluorosis. Okay, this one right here is fluorosis. This one right here is caries. Caries is less than 0.5. And we've also discussed fluorine को हटाने के लिए कौन सा टेक्निक है, guys? Nalgonda technique to remove एक्सेस ऑफ फ्लोरीन फ्रॉम द वाटर, जिसमें हम लोग 3 चीज़ डालेंगे, LAB, लाइम, एलम, ब्लीचिंग पाउडर. ओके, लाइम, एलम, ब्लीचिंग पाउडर हैज़ टू बी एडेड इन वाटर, डेवलप्ड बाय नालगोंडा टेक्निक, नीरी इंस्टीट्यूट. ओके, व्हाट इज दिस? इज इट जेनुवेरम और इज इट जेनुवैल्गम? इज इट जेनुवेरम और इज इट जेनुवैल्गम? सो आई हैव टोल्ड यू, गम से नीज जुड़ गए. दिस इज व्हाट? जेनुवैल्गम. ओके, जेनुवैल्गम. और यू कुड ऑल्सो कॉल इट एज नॉकनी. ओके, you could also call it as Knockney syndrome. This one where you have the bow legs. Okay, if you drink rum you can't walk straight. So ये क्या है? Genovarum. Okay, Genovarum. This is vitamin D deficiency. All right, this is vitamin D deficiency. But this one is which one? Genovalgum. Okay, all right. Okay, chalo. So we are done with question number. या 102 भी हो गया, फ्लोरीन भी हमने देख लिया. ऑलराइट, कम टू 103. हुज लोगो इज दिस? आइडेंटिफाई द लोगो बिलो. August 2020 क्वेश्चन. आइडेंटिफाई द लोगो बिलो. क्विकली टेल मी व्हाट इज द आंसर टू दिस. आइडेंटिफाई द लोगो बिलो. Whose logo is this, guys? Whose logo is this? Very good, Bureau of Indian Standards. Now you all have to remember a few things over here. See, if you talk about Bureau of Indian Standards, okay, इसका लोगो किसको चाहिए? If we desire excellence above minimum, ठीक है, excellence above minimum quality, okay, excellence above minimum चाहिए तो BIS का मार्क लगेगा. ठीक है, if you want minimum quality का things, minimum quality के लिए we have PFA, ठीक है, Prevention of Food Adulteration Act. If I need excellence above minimum, ठीक है, minimum quality से ऊपर, excellence above minimum, that is BIS. This is a part of ISI only, Indian Standards Institute. Okay, now what is this FSSAI? Look at this. FSSAI is Food Safety Standard Authority India. इसका headquarter is in New Delhi, guys, and FSSAI has given us the national food standards. Okay, national food standards. This national food standards हमने किससे adopt किए हैं? Codex Alimentarius. Codex Alimentarius is running the international, I mean it is setting the international food standards, जिसमें 2 organization है, WHO and FAO. ठीक है, okay. And for agricultural products, guys, you have AgMark. Okay, AgMark is for agricultural products. Clear? AgMark is for which one? Agricultural product. So over here I asked you BIS, excellence above minimum, we need BIS mark. ठीक है, क्वेश्चन नंबर 104. और मिनिमम क्वालिटी के लिए PFA मार्क चाहिए. ठीक है, चलो इसका आंसर बताओ. A hand washing awareness session was conducted in a community. The correct sequence of events here is, what is it? Hand washing sequence. Now let us see a few questions on health, education and communication. Very good, guys. So see, you have a communication cycle. There is a sender who frames a message. Okay, then you have a proper channel. Okay, and it goes to the receiver. Now receiver is the audience, इससे feedback लेता है. Now if I tell someone that okay, you should brush your teeth, or you should get your children vaccinated, वो करने लगेंगे? नहीं. There is a sequence of events which leads for anyone to adopt a habit and sustain it. Okay, that is where health education motivation model comes into play. So ये कैसे होता है? The message that you send out should generate an awareness. monotonous, okay? It should be interesting, okay? It should motivate you, all right? Motivation. Then you should think, okay, really अगर मैं ऐसे करूँगा, like you need to evaluate, okay? And then you will adopt it, okay? In planning cycle evaluation हमेशा last में है, but health education, ये जो पूरी चीज़ हमने red में लिखी है, this is what motivation model, okay? This is what motivation model, all right? Okay, and this is the most used model for health education, okay? So what is the answer? ये मत सोचना कि evaluation end में होगा, नहीं, वो planning cycle में होता है. यहाँ पे what is it? Awareness, interest, evaluation, and then we are going to adopt the technique, okay? All right. Next question. What is the answer to this one? What is the answer to this one? Question number 105. During vaccination drive, a male patient asks the presiding doctor if the recommended vaccine can lead to impotency. Which type of barrier is the doctor addressing? Now, every time it's not necessary that you're that whatever try to convey is going to reach. There are certain barriers. Now these type of barriers, okay, it depends on our beliefs, on our customs, on our cultures. So what is it? This is cultural barrier, okay? Which type of barrier are we talking about here? Cultural barrier. You have different barriers. Physiological is when some physiology is affected, we're not able to hear, we're not able to express. Psychological is our level of intelligence, language, all those is affected. Environmental is like जब बहुत सारे लोग बोलने लग जाए तो how am I going to communicate? This is most important barrier to be addressed because it relies on customs, beliefs, religions, okay? So that is again important, okay? Going to 106. Chalo, let's focus everybody. Giving class in a village for wound care after a dog bite by enacting it is which mode of health communication? Guys, you'll have to just give me one moment, okay? ठीक है. So what is the answer to this one, guys? Enacting it, what is this? This is demonstration. ठीक है. ORS preparation, ये सब क्या है? Demonstration है. Demonstration ये सब क्या है? Two-way technique. All right, two-way. Lecture always remember is one way. One way मतलब didactic. Okay, didactic. All right. चलो. Question number 107. See. Best method to teach an urban slum about ORS. Again, what is your answer to this? Again, ORS के बारे में दिखाना. So this is demonstration. Demonstration relies on seeing is believing. Okay, it relies on what? Seeing is believing and learning by doing. Okay, seeing is believing and learning by doing. Okay, seeing is believing and learning by doing. Clear? All right. Going to the next one. Question number 108. What is your answer to this? Many times this comes in our exams. 4 to 8 speakers talk about a specific topic in front of a large audience. There is no particular agenda, set speech or order of speaking. In the end, there is an interaction with the audience. What is this mode of communication best known as? Now you can see over here, be careful while you're marking, guys. 4 to 8 experts. Now 4 to 8 experts can be panel also, symposium also. But here there is no particular agenda, no set speeches, no order of speaking. That means it's like a news channel. So what is it? Panel discussion. Okay. And the experts. Now when I say talk about a specific topic in front, the experts can intervene in between. Okay. What can the experts do? The experts can intervene in between. Okay. Intervene in between. All right, experts can intervene in between. And what is, if you talk about symposium, okay, what is symposium, everybody? So symposium always has set speeches, okay, set agenda. All right, it also has a set order of speaking. Okay, it also has a set order of speaking. Okay, it also has a set order of speaking. That you should remember. And there's no interference. Okay, no interference from experts. No interference from experts. Okay, no interference from experts in between. All right, so that is very, very important. Chalo. Let's go to question number next one, 109. Confidentiality is maintained in which of the following conditions? Can you answer this? All right, what is the answer to this? Confidentiality is maintained in which of the following conditions, everybody? Group discussion, counseling, panel discussion, seminar. What is it? Confidentiality किस में maintained होता है? Counseling. ठीक है? All right. चलो, let's go to the next. Let's go to the next question, guys. 110th question बोलो. A 35-year-old man is unemployed because he is unable to walk after an accident. His unemployment is classified as, क्या होगा इसमें? Unemployment. He is unable to walk after an accident. So what is the answer to this? He is unable to walk after an accident. Okay. अब वो चल नहीं पा रहा. ठीक है. So what is his unemployment classified as? Now see, we all know there is DIDH, DI, okay, DI, and then there's a D and there's a H, DIDH, okay, DIDH. D is what? D is like disease, okay, disease. So what do you mean by disease? Disease over here is like an accident, okay. Now because of that accident, what happens? He lost his foot, okay, loss of foot or loss of legs, okay. Now his anatomy of the body has got affected. So this is what? Anatomical impairment, okay. This is what? Structure has got affected. This is anatomical impairment. When your function gets affected, physiological. When your mentally something gets affected, psychological. Now because of this, cannot walk, okay. Now walking is an activity, okay. So when your activity gets restricted, usko kya bolte hain? Disability. Now because of that, what happens? He loses his job. He's unemployed, okay. So that is what? He's handicapped, okay. Unemployment. You can't fulfill your roles and responsibilities. यहाँ पे मैंने क्या पूछा था? Unemployed. That means you can't fulfill your roles and responsibility. So what is this? He's a 35-year-old is unemployed. I'm asking you about unemployment. So will it be disability? No. I'm asking unemployment. So unemployment क्या हो जाएगा यहाँ पे? Handicap. Clear? Everybody, did you get this question? All right? Okay. चलो 111 पे आ जाओ. Burden of a disease is best is given by. What do you use to give the burden of a disease? Burden of the disease. Basically, I'm asking you सबसे अच्छा measure burden का क्या है? Burden of the disease. Now, please remember best measure. Okay, best measure of burden of disease. It's best measure of burden of disease. Okay, best measure of burden of disease and also effectiveness of intervention. Okay, effectiveness of interventions. All right. Quali, we have discussed. Quali is the number of years that get added to your life, okay, in good quality because of a medical intervention. Quali के साथ एक फैक्टर हम लोग कैलकुलेट करते हैं, यूटिलिटी वैल्यू फॉर मेडिकल इंटरवेंशंस. ठीक है, यूटिलिटी वैल्यू, दैट इज योर बज़वर्ड. यूटिलिटी वैल्यू फॉर मेडिकल इंटरवेंशंस ये कैलकुलेट होता है. यूटिलिटी वैल्यू फॉर मेडिकल इंटरवेंशंस, ओके, ये कैलकुलेट होता है. हेल के साथ बेसवर्ड क्या है? हेल के साथ इट इज ऑलवेज number of years a newborn is expected to live in full health. That is your buzzword. Sullivan's index क्या है? Life expectancy minus duration of disability. Okay, disability free life expectancy. That is Sullivan's index. Okay, best measure burden का डाली है, but which is the most commonly used measure, like, or which is the simplest measure of burden of a disease, guys? If I have to express simplest measure, if I talk about simplest measure of burden of disease, what is your answer to this? Simplest measure of burden of disease क्या है, guys? PMR, proportional mortality rate. Okay. All right, let's go to next question, 112. What is your answer to this one, everybody? What is your answer to this one? A person going for a self-health checkup to a hospital as his father died last week due to ischemia. Which level of prevention is this? Now, he's died last week due to ischemia. I don't think he's a risk factor for the child. No. Here it is that any time if you go for a health checkup, it is to make an early diagnosis. Okay? It is to make an early diagnosis. So, when you have to make an early diagnosis, which level of prevention is it? Secondary. Okay? Whenever you go like health checkup हो गया, health camp हो गया, ठीक है, health camp हो गया, all these are which levels of prevention, everybody? Secondary level of prevention. Okay, to make an early diagnosis, it is what? Secondary level of prevention. Okay, so this you should remember. All right, going to question number 113. A government plans to outline tobacco control laws. Okay, we have to control the tobacco control laws. What is the level of prevention over here? Now, you plan to outline tobacco control laws. When I say tobacco control laws, that means what? If I say tobacco control laws, that means the people are already like, the tobacco is already there. Okay, so now we have to control it. So, which level of prevention it is? Primary prevention. Okay, tobacco control law. Specific protection. Okay, tobacco control laws. Okay, so that is specific protection. All right, coming to the next question, everybody. Hand washing. Levels of prevention तो एग्जाम में आता है, so obviously we can't miss it out. Hand washing during COVID-19 is which level of prevention? Now again, when we when you wash your hands, why you are asked to wash your hands continuously? ठीक है, why you're asked to wash your hands continuously? You're asked to wash your hands continuously because risk factors are present, right? So kaun sa level of prevention hai? Primary level of prevention. Okay, all right, now I particularly said COVID-19, so specific protection. Okay, let us see this one. A 45-year-old man with a history of small streaks of blood in his stool is being sent for colonoscopy to screen for colon cancer. Now, we have to screen for colon cancer. So, what is screening over here? Screening is which level of prevention, everybody? Very good. Secondary, to make an early diagnosis. Okay, let us see question number 116. True about PQLI. PQLI and HDI, you're not going to forget, okay? It keeps coming in your exams. You should revise PQLI and HDI. क्या है आंसर इसका? Very good. Life expectancy at 1 year, IMR, literacy rate. Okay, is it replacing GNP? No, it's not replacing. It's not going to replace gross national product or something. Okay, so look over here. You have two things, okay? PQLI, HDI. PQLI के साथ हमने हमेशा न्यूमोनिक पढ़ा है इल. Okay, ill, all right. Ill is infant mortality rate, life expectancy at age 1 and literacy rate. HDI के साथ क्या है? Kill. Okay, kill. K से knowledge index जिसमें mean years of schooling एंड एक्सपेक्टेड ईयर्स ऑफ स्कूलिंग ले लो, ठीक है. और तुम्हारा आई से क्या हो जाएगा? सी, इज देयर any development without income? No. So what is it? Gross national income. Okay, gross national income, or you could also say gross national product. And let us look at development right from birth. Okay, now please remember this has changed. The rank is 134. Okay, 0.644, the rank is 134. ठीक है, चलो. So you always remember this one, PQLI, HDI, global hunger index. ये we have revised in concept of health also. Okay, question number 117. Let's see if you can do it. What is the correct percentage for spending on health as proportion of GDP of the country? Abhi right now India is spending what percent of GDP on health? See, 1% बहुत कम है, ठीक है. 3 और 5% बहुत ज़्यादा है. Okay, is it spending 5%? No. What is this? 5% में तो इंडिया डेवलप्ड हो जाता. समझ रहे हो? WHO कहता है कि 5% स्पेंड होना चाहिए. राइट नाउ इट इज नियर अबाउट 1 point something. ओके, सो ओवर हियर द करेक्ट आंसर इज 2%. ऑल राइट, ठीक है, इट इज 2%. बट प्लीज रिमेंबर, इंडिया aims to spend, okay, aims to spend 2.5% of GDP, 2.5% GDP by 2025. Okay, India aims to spend 2.5%, और डेवलप्ड होने के लिए किसी भी कंट्री को 5% GDP स्पेंड करना चाहिए. Okay, 118. Number of maternal deaths per 1 lakh live births. Very, very commonly this question comes. Tell me the answer to this. Number of maternal deaths per 1 lakh live births. What is your answer? Very good, guys. Live births मतलब numerator is not a part of denominator. This is maternal mortality ratio. और maternal deaths क्या होता है? You have to know this is deaths during antenatal period. Okay, deaths during antenatal period, ANC period, during intranatal, during delivery and postnatal. Okay, postnatal. Postnatal is up to how many weeks? Up to 6 weeks. Postnatal is up to 6 weeks post delivery. Okay, up to 6 weeks. exposed delivery. But you will never include accidental incidental causes. So exclude accidental incidental causes. Okay, exclude accidental incidental causes. Remember one thing guys, rate में denominator is numerator has to a part of denominator. तो denominator क्या हो जाएगा उसमें, women in reproductive age group. ठीक है, all right. Chalo, let's go to the next question. 119. What is the most common indirect cause of obstetric death? Direct is hemorrhage, indirect is anemia. Okay, direct is hemorrhage, indirect is anemia. Clear? Okay, infant mortality rate is defined as number of infants for every. Now, I've always told you, although we'll have a separate class of numericals, I've always told you guys that remember one very, very important points, that for child health indicators, multiplier 1000 है और denominator live birth है. Okay, so what is your answer over here? पर 1000 लाइव बर्थ्स. ठीक है, चाहे वो इन्फेंट मोर्टेलिटी रेट हो, चाहे वो अंडर 5 मोर्टेलिटी रेट हो, चाहे वो न्यूनेटल मोर्टेलिटी रेट हो, इट इज ऑलवेज पर 1000 लाइव बर्थ्स. ओके, all right. Question number 121. Let's see if you can do is, what is neonatal mortality rate? Calculate karo isme. What is the neonatal mortality rate over here? Anybody? 1 lakh is the multiplier only for maternal mortality. ठीक है, सिर्फ maternal mortality के लिए 1 lakh multiplier है. बाकी सब जगह the multiplier is always, remember, it is 1000. Okay, it's only for maternal mortality, it is 1 lakh. Okay, and rest जैसे prevalence हो गया, case fatality rate, secondary अटैक रेट, उसमें मल्टीप्लायर 100 है. अब देखो, आई आस्क्ड यू, okay, I asked you to calculate NMR. NMR means, okay, all right, you have to have death in the neonatal period, 0 to 28 days. Now here, 40 newborns die within first 7 days of life. So 40 plus 40 die due to between 8 to 20 days. So 40. All right, per 1000. All right, now there were 50 deaths between 1 month to 6 months. उसका कोई लेना देना नहीं है, because that's after neonatal period. Okay, and what you have to take per 1000 live births. So that is what, 4000. Okay, yes, everybody. So this comes out to be how much? 20 per 1000 live births. So what is your answer? 20. Okay, don't worry कि यार we won't include this one, 50 deaths. That's no need. So sometimes they can give you values which will not include, which don't need to be included in the question. ठीक है, so I told you child health में everywhere multiplier is 1000, denominator और तुम्हारा this thing is, we always express in live births. Okay, all right, 122 question. Tell me the answer to this. According to school health, minimum area for each student in the classroom should be kitna? Minimum area for each student in the classroom according to school health. What is the minimum area for each student in the classroom, everybody? Very good, 10 square feet. Okay. Question number 123. The school health programs are managed by 10 square feet सबके लिए होता है. ठीक है, school health program कौन manage करता है? School health program is managed by, is it sub centers? No, it's the responsibility of primary health center. वहाँ पे medical officer है, he should go and do a school health checkup once every 6 months. Okay, once every 6 months. Eye checkup of course school teacher भी कर सकती है. ठीक है, आई चेकअप. विजुअल एक्विटी लेस देन 6/9, देन द चाइल्ड नीड्स टू बी रेफर्ड. ओके, ऑल राइट. ऑल्सो नाउ स्कूल हेल्थ स्क्रीनिंग इज अंडर आयुष्मान भारत एज वेल. ठीक है, दैट यू शुड नो. All right, let's go to question number 124. Let's see some more points. ठीक है, all of the following are minimum standards for sanitation of school and its environment in India except desk minus type. Yes, doors and windows 25%. When you talk about household, this thing, okay, house, tab doors and windows is 2/5 of floor area. Here 25. Minimum 40 students. Yes. One urinal is for 10 students. No, one urinal is for 60 students. One latrine is for 100 students. Okay, and most common infection जो school health में निकलता है guys, that is dental infections. Okay, dental caries and periodontal diseases. All right, going to the next one, 125. Tell me the answer to this. A primigravida delivers a healthy baby boy, normal delivery after how many hours? Now ideally when should breastfeeding be started? As soon as possible. It doesn't any longer deal with 1 hour or 4 hour or 3 hours. No, as soon as possible after delivery. Okay, as soon as possible after delivery. So over here, when should it be initiated? Within 1 hour. Okay, as soon as possible within after delivery. So it is what? Within 1 hour. Okay. Okay. Also, like, let's look at this one. Exclusive breastfeeding is up to the age of 6 months, can be continued up to 1 year. Human milk में सबसे ज़्यादा lactose होता है guys, याद रखना. Energy 65 and proteins कभी कभी पूछ लेते हैं. ठीक है. Those 2 points you should know. All right. Coming to question number 126. Social factors in disease causation. What is it? Social factors in disease causation. Sociology? No. Sociology is the study of human relationships, okay? Human relationships and human behavior. All right, human behavior. Social causes is social pathology like addiction, unemployment. Okay, all those are social causes. Okay. Now, society is group of individuals living to a group of individuals sharing common value and interests. All right, that is societies leading a certain way of life. What is community? It is nothing but society within geographical boundary. Okay, it is nothing but society within geographical boundary. That is what is community. Okay. All right. Question number 127. Let's see if you can do it. And one thing you should also know guys, what is acculturation? बहुत आने के chance होता है. Acculturation is exchange of cultures, okay, or you could say cultural contact. Okay, cultural contact. What is the answer to this one guys? Which happens during marriage, education, conquest. Okay, knee reflex किसी को दिखाना सिखाना is what? Psychomotor learning, skill development. It's psychomotor learning. Question number 128. Anybody? Question number 128. What is the answer to this? Jan 2023, a surveyor has visited a household consisting of a 25-year-old man, his wife who is 6 weeks pregnant, and a 3-year-old child. The man's brother, along with his wife, is currently visiting them for a month owing to winter vacation. Now, no matter like even if you visit, they are not a part of your family, right? They don't belong to your family. So your family is still a nuclear family. Okay, all right. They need to belong to your family. Broken family क्या होता है? Couple is divorced, separated. जो आते हैं ना वो याद रखना. Broken family, couple is divorced. Okay, couple is divorced, separated. Parent, either parent is killed. Okay, either parent is dead. You should say either parent dead. Okay, then there's a problem family. Problem family क्या होता है? Family lags behind the rest of the community. Okay, family lags behind the rest of the community. And then you have a communal family. What is communal family? Roles and responsibilities are divided. Okay, roles and responsibilities are divided. Okay, roles and responsibilities are divided. ठीक है. Also guys, family में ना एक family cycle पे question आता है. हमने कल disaster cycle पढ़ा, डेमोग्राफी ट्रांजिशन मॉडल देख लिया, कम्युनिकेशन साइकिल देख लिया, एक फैमिली साइकिल भी है. बताओ इसका आंसर. अ कपल हैज गिवन birth to their first child based on nuclear family cycle. Which phase are they entering into? So basically I wanted to discuss that how will you denote the phases. ठीक है, phases कैसे denote होता है? फर्स्ट पार्ट से या सेकंड पार्ट से? जैसे देखो, formation is marriage to birth of first child, extension is birth of first child to birth of last child, complete extension is birth of last child to first child leaves home, contraction first child leaves home to last child leaves home, complete contraction last child leaves home to first spouse dies, dissolution first. अब हर एक स्टेट, जैसे मान लो मैंने बोला birth first child leaves home, will it be complete extension or contraction? It will be contraction. So each of the phase is denoted by the first part. Remember this. ठीक है, पहला पार्ट सारे फेज को डिनोट करता है. ओके, सो यहाँ पे आई गेव यू birth to their first child. So marriage to birth, is it formation? No, it is what? Extension, because birth to the first child is a part of this one. It is extension. Always remember the first phase is denoting the first part. Okay, all right. Question number 130. Which of the following is not a component of RCH program? Safe motherhood, women education and empowerment, children in newborn care, screening and treatment of disease. Anybody? सेफ मदरहुड तो बहुत इम्पॉर्टेंट है. यस, बेसिकली रिप्रोडक्टिव हेल्थ, मैटरनल हेल्थ, न्यूबॉर्न, ये सब आता है इसमें. सो यू कैन गो थ्रू दीज सर्विसेज विच आर बीइंग केटर्ड ओवर हियर. यू ऑल्सो, वी आर ऑल्सो लुकिंग एट रिप्रोडक्टिव हेल्थ में वी आर टॉकिंग अबाउट वी आर टॉकिंग अबाउट टेकिंग केयर ऑफ द वुमन. वी आर नॉट टॉकिंग अबाउट वुमेन एजुकेशन. दैट्स ऑल टुगेदर अ डिफरेंट थिंग. ओके, दैट्स ऑल टुगेदर अ डिफरेंट थिंग. ऑल राइट, वुमेन एजुकेशन एंड एम्पावरमेंट. All right, let's come to the next important question over here, which is question number 151. Sorry, 100 and kaun sa question pe 31. All right, let's see the answer to this, everybody. A patient from a northeastern state was diagnosed to have an infection with Plasmodium falciparum. What is the appropriate management over here? What is the most appropriate treatment? Now, you all know northeastern state. Falciparum. क्या दोगे? ACT तो दोगे ही. And in other states, okay, if it is other states, it is ACT SP. All right, ACT SP. But northeastern में बहुत common है malaria, okay, ACT LM. So artemether lumefantrine. Of course, you have to add primaquine. Okay, primaquine is only contraindicated in pregnancy. ठीक है? All right. Question number 132. Anybody? Let's see. A researcher was studying an Plasmodium species, decided to visit the malaria endemic place in Odisha after 2 days to do his clinical study for 5 weeks. Which of the following drugs need to be taken as prophylaxis before visiting the malaria endemic days? So, endemic place. What is it, guys? We all know short-term prophylaxis के लिए क्या है? Doxy. A to D, the distance is short. A to M, the distance is long. So, look over here, everybody. Long-term prophylaxis. If you're going for more than 6 weeks, it is mefloquine. Start 2 to 3 weeks before and continue 4 weeks later. Short term is less than 6 weeks. What is it? It is doxycycline. Start 1 to 2 days before and continue for 4 weeks post travel. This question is important. Okay, it can get repeated again, the treatment and prophylaxis of malaria. Okay, what is the answer to this? Quickly batao. What is the health insurance package provided to an eligible family per year in the Ayushman Bharat? सबको पता है ये वाला. I hope 5 lakh per family per year. ठीक है. Number of family members is no restriction. Okay, number of family members no restriction. Okay, number of family members कोई restriction नहीं है. And age no restriction. Okay, no restriction. In some states it is 10 also, but now overall it is still 5. Okay, and this is the logo of प्रधानमंत्री जन आरोग्य योजना आयुष्मान भारत. आजकल एक आयुष्मान भारत का डिजिटल कार्ड भी होता है. And under this Ayushman Bharat, what is the update? Health and wellness centers have been upgraded to what will we call it as Arogya Mandir. Okay, Arogya Mandir. Clear? Okay, what is the answer to this? Identify the logo. 10 more minutes, guys. What is the answer to this? This is what? This we all know is Suraksha Clinic. Okay, now if you look at the remaining options, I hope you know it. Suraksha Clinic is an initiative under NACP only, guys. All right, National AIDS Control Program to promote sexual and reproductive health. Now look over here. This is NACO. इसका headquarter कहाँ है? ठीक है, इसका headquarter is New Delhi. All right, इसका headquarter is New Delhi. This is family planning का logo. ठीक है, and this is international, sorry, that is International Red Cross. Okay, all right, next question. What is the most rapid lab diagnosis of pulmonary TB can be done by? Most rapid lab diagnosis, if I give you pulmonary TB का सबसे rapid lab diagnosis कौन करेगा? What is the most rapid lab diagnosis of pulmonary TB? Most rapid lab diagnosis. Okay, all right. So lab diagnosis of pulmonary TB. Okay, so yes, you can go for a now I'm asking you most rapid question. तो देखो most rapid बोल रहे. CB NAT का रिजल्ट कितनी देरी में आता है? CB NAT का रिजल्ट कितनी देरी में आता है? CB NAT का रिजल्ट आता है within 2 hours. Okay, what about sputum culture? They take a lot of time. Okay, what about sputum microscopy, everybody? What about sputum microscopy? Just a second, guys, I'm getting a call. Just 1 second. Alright, चलो बताओ इसमें. Yes, sputum microscopy तो टाइम लेता है. What is the answer over here? It is most rapid lab diagnosis, CB NAT. Okay, alright, let's do 135. Question number 135. Niti Aayog has replaced. What has Niti Aayog replaced? Quickly बताओ. Niti Aayog has replaced what? Niti Aayog has replaced. ठीक है, Niti Aayog has replaced the National Planning Commission of India. Okay, and when? Jan 1, 2015. Niti Aayog is the think tank of India. Okay, iska chairperson is the Prime Minister. All right. National Institution of Transforming India. Don't say institute. National Institution. Okay, National Institution of Transforming India. National Institution of Transforming India. That is Niti Aayog. All right. Okay. Chalo, come. Let's go to question number 136. Infectivity is best denoted by. What is infectivity best denoted by? देखो, virulence is denoted by case fatality rate. Okay, virulence is what? Virulence is case fatality rate. Infectivity or transmissibility or communicability of a disease is denoted by secondary attack rate. Serial interval is the time between onset of प्राइमरी केस एंड सेकेंडरी केस. ठीक है, प्राइमरी एंड सेकेंडरी केस इनके बीच जो टाइम लग रहा है, ठीक है, दैट इज सीरियल इंटरवल. नाउ आई विल गिव यू अ न्यूमेरिकल ऑन सेकेंडरी अटैक रेट व्हेन वी हैव द न्यूमेरिकल क्लास. ओके, इन्फेक्टिविटी और कम्युनिकेबिलिटी इज बाय सेकेंडरी अटैक रेट. ये दोनों के न्यूमेरिकल वी विल डू इन न्यूमेरिकल क्लास. ओके, इट कैन come. All right, 137 question. Let's see if you can do it. A patient comes with a history of category 3 dog bite. He received prophylaxis for a monkey bite 6 months back. Now number 1, category 3 मतलब आपको क्या क्या करना है? वूंड क्लीन करना है. ठीक है, कैटेगरी 3 आइडियली वैक्सीन दो प्लस इम्यूनोग्लोबुलिन. बट यहाँ पे हैज रिसीव्ड अ बाइट 6 months back. So this is a case of what? This is a case of re-exposure. Re-exposure. Now you have to see whether re-exposure is within 3 months or beyond 3 months. Okay, within 3 months, all right, or it is more than 3 months. Okay, so now within 3 months में nothing has to be done. Okay, nothing has to be done. Beyond 3 months, this has 2 letters. Re has 2 letters. So 2 letters meaning कितने visits guys? 2 visits. And when will we make those visits? Day 0. 2 visits मतलब day 0 and 3. Okay, so it is day 0 as well as day 3. Okay, remember this. Otherwise schedule इंडिया में कौन सा प्रेफर करते हैं guys? कैटेगरी 3 या कोई भी वैक्सीनेशन में यू हैव टू रिमेंबर अपडेटेड थाई रेड क्रॉस रेजिमेंट. ठीक है, कौन सा स्केड्यूल प्रेफर्ड है? ये देखो सारे स्केड्यूल है. पोस्ट एक्सपोजर में दिस वन, पोस्ट एक्सपोजर इंडिया में थाई है. नाउ थाई हैज 4 letters, so 4 visits, day 0, 3, 7, 28. SN is being not given under the program. All right, that you should remember. India में it is the updated Thai Red Cross Regiment. Okay, all right, so we have done 137. Let's do 138. We'll be doing a total of 150 questions. Okay, what is the answer to this one? A pregnant lady आई है who has presented to the casualty after she was crashed by a street dog. Now only thing I wanted you to remember, rabies vaccine is a killed vaccine. Okay, so will you give the vaccine? Of course you will give the vaccine. Okay, now she has been scratched by this thing. There is no bleeding. So what is this guys? Category 2. Yes, so what will you do? Local wound cleaning and rabies vaccine. ठीक है, rabies vaccine killed vaccine है तो आप आराम से उसको लगा सकते हो. ठीक है, you can very well give the vaccine to the lady. Okay, let's take up question number 139. You are the doctor in a village. A 2-year-old child presents with fever and cough for 2 days. On examination, he is calm with a respiratory rate of 45 breaths per minute. Chest and drawing is present. According to IMNCI, what is the management? Now, first thing, you have to always notice ki, are we talking about up to 2 months or 2 months to 5 years? So here we are talking about 2-year-old child. So हम लोग किस पे deal कर रहे हैं? We are talking about 2 months to 5 years. ठीक है, 2 months to 5 years. So up to 2 months में 2 months to 5 years. 2 months to 5 years में guys, no pneumonia, simple cough and cold, home advice and care. Okay, this is which color? Green color. Okay, if the baby has fast breathing and or chest and drawing, pneumonia, this you will manage according to the yellow color. Okay, yellow color. Yellow color मतलब OPD treatment, medical treatment. OPD करके उसको घर भेज दो. ठीक है, बट इफ इट इज डेंजर साइंस, स्ट्राइडर इन अ काम चाइल्ड, lethargy, not breastfeeding, okay, or a very high fever, cynosed, you will have what over here? No pneumonia, pneumonia not very severe. This is severe pneumonia. Okay, this is what? Severe pneumonia. This will be managed according to, ये manage किसके according हो रहा है? IMNCI. Okay, IMNCI. This is management for 0 to 5 years old. So this will fall under pink color. You have to immediately refer the baby. Okay, you have to immediately refer the baby. अब question देखते हैं, ठीक है? So यहाँ पे 2 साल का बच्चा है, 45 breaths. Now you have to remember one thing, rule of 60, 50 and 40. If the baby is up to 2 months, okay, up to 2 months, then you have to remember respiratory rate of more than 60 breaths, okay, more than 60 breaths per minute is fast breathing, okay. 2 to 12 months में कितना है guys respiratory rate? More than 50, okay. And 1 to 5 years, what is the respiratory rate? Respiratory rate more than 40. Here he has 45 and he's 2 years. So fast breathing present है. Plus बच्चे को और क्या हो गया guys? Chest and drawing भी है. Rest nothing is there, okay. So fast breathing as well as chest and drawing. There are no danger signs. So what is he falling into a category of? Pneumonia. सिंपल न्यूमोनिया. सो आप क्या करोगे? ओरल अमॉक्स दे दो एंड यू कैन सेंड फॉर होम रेफरल. क्लियर? होम मैनेजमेंट आई मीन. घर पे जाके यू कैन एडवाइज द मदर ऑफ द डेंजर साइंस एंड टेल हर व्हेन टू रिटर्न. इज इट क्लियर एवरीबडी? डिड यू अंडरस्टैंड दिस वन? ठीक है. अप टू 2 months के बच्चे में यू हैव नो न्यूमोनिया, सिवियर न्यूमोनिया, वेरी सिवियर न्यूमोनिया. ठीक है. और उसमें सिवियर एंड वेरी सिवियर को हमें इमीडिएटली रेफर करना है, वो पिंक कैटेगरी में आते हैं. बट 2 months से 5 years में अगर सिंपल न्यूमोनिया है, आपको उसको रेफर CHC करने की ज़रूरत नहीं है. ठीक है. All right. Quickly tell me 140 guys. Zika virus is transmitted by, what is your answer over here? Zika virus. Zika virus is transmitted by Aedes. Now Zika virus also leads to, remember this thing, Zika virus transmission, mother to child transmission भी होता है. ये इसका life cycle है and it also leads to microcephaly in the baby. Okay, microcephaly in the baby. All right. 141. What is the answer to this? Komal, a 2-year-old is brought to the clinic with high fever, cough, red eyes, rash. Patient says that the rash started on the forehead behind the ear. Behind the ear means retroauricular in origin. Retroauricular. Maculopapillar. ठीक है. So ये कौन सा disease है? If you talk about what is it? What is the answer over here? The period of infectivity is 3 days before and 5 days. The most common cause of death is subacute. नहीं. सबसे common cause of death subacute sclerosing panencephalitis है. बिल्कुल भी नहीं. बिल्कुल भी नहीं. Most common cause of death is pneumonia. Period of infectivity is 4 days before and 5 days after. All right. So what is your answer? Warthin feculent giant cells are pathognomic? No. Koplik spot are pathognomic. What is Koplik spot, guys? They are found on the buccal mucosa opposite the lower second molar. And Koplik spots always come before rash. ठीक है? Before rash. All right. Please remember this. Koplik spot pathognomic है. जब rash आता है ना, Koplik spot चले जाते हैं. ठीक है. Everybody. Most common cause of death, pneumonia. Most common complication in a child, in a young child, is otitis media. Otherwise, the most common complication of this thing is diarrhea. ठीक है. But young child में otitis media. Okay. All right. Tell me the answer to this. Shelf life of copper T 380A. What is the answer over here? 380A. I'll just tell you quickly. 10 years. ठीक है. एक चीज़ याद रखना, Myrina, which is LNG20. Okay. LNG20. उसका shelf life is now up to 7 years. 3rd generation. Okay. All right. 143. Which of the following is an absolute contraindication for the device shown in the image below? क्या है इसका absolute contra? Anemia? No. Uterine malformation, uterine fibroids? No. It is which one? Vaginal bleeding. ठीक है. Cancers absolute है. Relative ectopic pregnancy याद रखना आप क्या है? Ectopic pregnancy is relative. Okay. Ectopic pregnancy is which contraindication? Relative contraindication now. Okay. Going to question number. These are the contraindications you should know. All right. And also current PID is absolute. Okay. Current. Past history is relative. Okay. And also remember one thing, ectopic pregnancy is relative now. Ectopic pregnancy is relative. Okay. So come to 144 question. Let's see if you can do this. Which of the following is false? So again, this is a copper T. All right, it is inserted by withdrawal technique. It is used as emergency contraception. The copper in the device has a surface area of 380 square mm. Yes, it has a lifespan of 5 years, everybody. One second. What? Let me ask. Oh, so sorry. Yeah. So over here, if you have to select one, all right. One second. They asked about false. Right. One second. If you have to select one, see, period of infectivity ideally 3 days उतना appropriate नहीं है. But क्योंकि आपको false statement था, so false statement में most common cause of death is not subacute sclerosing panencephalitis, it is pneumonia. ठीक है. Now, if you have to go for the false statement, of course, B तो false है. But अगर बहुत ही ट्रू स्टेटमेंट भी मार्क करना है तब तुम्हारा कौन सा है कॉप्लेक्स स्पॉटा क्योंकि ये एग्जैक्टली 3 days नहीं है क्लियर ओके सिली मिस्टेक यस चलो लेट्स गो टू दिस वन या व्हाट हैव यू रिटन फॉर दिस वन एवरीबडी copper in the device has 380 this is 380A right this is completely straight and copper wire ये क्या है 380A लाइफ स्पैन 5 years है नहीं इसमें क्या पूछा है फॉल्स लाइफ स्पैन कितना है इसका 10 years है ओके ऑलराइट व्हाट इज द आंसर टू दिस वन टुडे मतलब कौन सा इमेज ये है दिस इज वजाइनल स्पॉन्ज इसमें कौन सा केमिकल होता है गाइस नॉन ऑक्सिनॉल 9 ओके इट्स अ बैरियर मेथड ओके यू कैन गेट एनी ऑफ द इमेज 146 ड्यूरेशन ऑफ बैरियर कॉन्ट्रासेप्टिव वेसेक्टमी अप टू 3 months ओके दे शुड यूज अप टू 3 months और पोस्ट और 20 इजैकुलेशंस फ्री नाउ अप टू 3 months यहाँ पे कितने वीक्स होंगे up to 3 months so कितने weeks होंगे everybody yes very good now see 3 to 8 to 12 weeks 8 तो कितना हो जाएगा it's 2 months all right so that is not a very reliable option over here we should go for the bigger one 12 to 14 weeks okay all right next 147 a male had a vasectomy 1 month ago and the couple asked the doctor if they have to take any precautions well what advice would you give oral contraceptive pills for 1 month use condoms for 3 months barrier methods for 3 months or up to 20 ejaculations free so please go and mark over here use condoms up to 3 months okay all right coming to 148 an 8 weeks pregnant woman working in an industry maternity leave कब तक दिया जाता है so you all know it can be given 26 weeks and you can take it 8 weeks prior to delivery in the PDF you will find all the benefits medical benefit full medical care है ये cashless है ठीक है इसको revise करके जाना है what is sickness benefit 70% for 91 days extended is for 2 years for 34 diseases enhanced vasectomy और tubectomy के लिए होता है ठीक है those are some important benefits that can come in your exams okay all right question number 149 बताओ a patient presents to an ESI hospital under the ESI Act he or she is treated for which benefit now ESI hospital please don't say sickness benefit it is what medical benefit okay medical benefit is full medical care okay medical benefit is full medical care come to 150 70% of wages for 3 months or 91 days okay so which benefit am I referring to it is nothing but sickness benefit okay extended sickness benefit is for 2 years which is at 80% of wages for 2 years okay so you should know about the benefits clear okay just a couple of more questions 5 more minutes what is the answer to this a worker with a history this is 151 30 years कार्डबोर्ड मैन्युफैक्चरिंग से कल भी पढ़ा था किसका रिस्क है बैकेसोसिस का ठीक है ऑल राइट क्वेश्चन नंबर 152 एनिलीन डाई एक्सपोजर ब्लैडर कैंसर सो ब्लैडर कैंसर का व्हाट इज द मोस्ट कॉमन डायग्नोसिस ओवर हियर एवरीबडी ट्रांजिशनल सेल कार्सिनोमा और मोस्ट कॉमन प्रेजेंटेशन इसमें क्या है हेमाचूरिया ठीक है देयर इज मोस्ट कॉमन प्रेजेंटेशन ऑफ हेमाचूरिया ठीक है all right coming to question number 153 sickness absenteeism tells us reflects on what is the rate of sickness absenteeism in India 8 to 10 days per person per year okay per person per year so it is reflecting on what state of health of workers okay state of health of workers ओके कंट्रोल टिपिंग सैनिटरी लैंडफिल में कितना ज़मीन चाहिए 2 मीटर डीप ट्रेंचेस डग फॉर अ पॉपुलेशन ऑफ 10,000 एंड वी रिक्वायर 1 acre लैंड एवरी ईयर ओके ऑल राइट लास्ट क्वेश्चन फॉर द डे सॉरी ये तो इमेज आंसर ही दिख गया इसका आंसर क्या है, इसका आंसर क्या है? नाउ आई हैव ऑलरेडी शोन यू द आंसर ओवर हियर. ओके, 5 more minutes. So this was nothing but, you can see there is short body and long legs. Okay, this is not ADs. Hunchback है, short bodies, long legs. This is not ADs, so not chikungunya. Not sandfly, doesn't have a hairy wing. Not sandfly. Malayan filariasis mensonia कराता है. Mensonia squatting position में होता है. ये क्या है? Culex. This is what? Culex. Okay, long short body and long legs. Okay, short body, long legs. Okay, this is what? J, Japanese encephalitis. What else does it gets done? Filariasis. Okay, lymphatic filariasis. We will have an image class, so you don't have to worry. Okay, SDG comes under which one? SDG किसका initiative है? Everybody. All right, SDG किसका initiative है? Can you tell me? 156. SDG I've told you किसने frame किया है? UNDP and United Nations. Okay, please don't say United WHO. बिल्कुल भी नहीं, ठीक है? All right. Okay, which of the following, okay, ultimate desired state towards which objectives and resources are directed is always a goal. Okay, all right, just 2 more questions to go. What is the answer to this one? The management wants to know, 158. Management wants to know how much each doctor is spending with a patient on an average. So this is a health management technique. इसका आंसर क्या है? कितना टाइम एक पेशेंट अपने एक मतलब हेल्थ वर्कर्स का काम नोट करना, लैब टेक्नीशियंस. दिस इज नथिंग बट वर्क सैम्पलिंग. ओके, वर्क सैम्पलिंग. What about this one? Another way of asking, systematic observation and recording of activities of one or more individuals. This again is work sampling. All right. ऑल राइट, ट्रायाज बताओ. हाईएस्ट प्रायोरिटी एंड डेड पेशेंट. हाई या हाईएस्ट प्रायोरिटी, कौन सा कलर जाएगा? रेड. डेड कौन सा कलर जाएगा? ब्लैक. सो व्हाट इज योर आंसर ओवर हियर? व्हाट इज योर आंसर ओवर हियर एवरीबडी? व्हाट इज योर आंसर ओवर हियर? योर आंसर ओवर हियर इज रेड एंड ब्लैक. ओके, all right, let's come to one more question. 161. A study was done. Okay, yeah, just 2 more. A study was done to assess nutritional status among young children in rural and urban areas. 40 children in rural and 30 are malnourished. Now I've always told you, approach लो, quantitative, qualitative. अगर qualitative variables है, we will go for a non-parametric test. अब यहाँ पे I'm looking at malnourishment. Malnourishment is a qualitative variable. Okay, it is a qualitative variable. So which one will I use? I will always use a non-parametric test. Okay, quantitative तो नहीं है, it is a parametric. It is a qualitative variable, right? So I will use a non-parametric test. I will use a non-parametric. How many children are malnourished? It doesn't have a unit. Plus 2 groups में देख रहे हो. देखो, children rural area में देख रहे हो and urban area में देख रहे हो. And you are looking at what? Malnourished status. Okay, malnourishment. So which test will you use? You're going to use nothing but a chi-square test. If you had a quantitative variable, we would have gone for a पैरामेट्रिक टेस्ट. देखो जैसे ये वाला क्वेश्चन. 162. There is 200 hypertensive patients. First group of 100 patients is given medical advice, whereas the second group is advised lifestyle. Which of the following is used to compare blood pressure? Now see, blood pressure quantitative है या qualitative है? Blood pressure of course is quantitative. Why? Because it has a unit. You can measure it. Now you had initially a group of 200. You've divided into 100 and 100. So now what will you do? 100 को medical advice दे रहे हो, 100 को lifestyle दे रहे हो. अब ब्लड प्रेशर असेस करो. सो 2 ग्रुप्स हो गया. ब्लड प्रेशर क्वांटिटेटिव है. दिस इज व्हाट? अनपेयर्ड टी टेस्ट. टुडे आई हैव डिस्कस्ड बायोस्टैट ऑन प्रेपलैडर का यूट्यूब चैनल. प्लीज गो एंड गो थ्रू इट वंस. वी हैव टॉक्ड अबाउट पैरामेट्रिक एज वेल एज नॉन पैरामेट्रिक टेस्ट. Okay, last question. 169. 163. Which type of population pyramid is this? This is a developing nation pyramid. Okay, so you have to tell me all are false except. As the height increases, life expectancy decreases. No, it increases. Okay, base denotes fertility. Yes. Okay, ठीक है, base denotes fertility, young children. All right. ब्रॉड बेस मीन्स मोर नंबर ऑफ वर्किंग पॉपुलेशन, नो, ब्रॉड बेस का मतलब क्या होता है, ब्रॉड बेस का मतलब मीन्स मोर नंबर ऑफ वर्किंग पॉपुलेशन, ओके। मिडिल, ऑल आर फॉल्स एक्सेप्ट मिडिल पार्ट इंडिकेट्स मोर मेल्स देन फीमेल्स, ऐसा है क्या? मिडिल पार्ट आपको इंडिकेट कर रहा है कि ज़्यादा सोच के आंसर करो गाइज। ब्रॉड बेस मतलब मोर वर्किंग क्लास, नो, ब्रॉड बेस मतलब बेस इज ऑलवेज चाइल्ड, ओके, चाइल्ड पॉपुलेशन, more fertility, more young child expectancy. Middle part indicates more male, middle part is just telling working class. It could be here, it's symmetrical, it could tell us both males and females. Base denotes fertility, yes, base denotes what? Fertility. So many of you I saw answering in a rush, C बिल्कुल नहीं। जो लोअर पार्ट ऑफ द पिरामिड होता है वो चाइल्ड होता है, बीच का कास्ट वर्किंग क्लास होता है और ऊपर एल्डरली होता है, ठीक है। इंडिया डेवलपिंग कंट्रीज ब्रॉड बेस मतलब मोर फर्टिलिटी। ऊपर ऊपर जाओगे लाइफ एक्सपेक्टेंसी बढ़ता जाएगा, ओके। सो यहाँ पे इट्स एन acute apex because there's low life expectancy. Clear everybody? Did you understand? Plus ये जो डेवलपिंग कंट्री है ना ये asymmetrical है, ओके, दिस इज व्हाट asymmetrical. Asymmetrical means not an ideal sex ratio, not an ideal sex ratio, all right, it's representing not an ideal sex ratio. So more importantly the answer over here is base denotes fertility. No guys, this is a developing pyramid, have a look at it again, ठीक है। सो डेवलप्ड पिरामिड ये होता है, ये डेवलप्ड है, कैन यू सी दिस, दिस इज डेवलप्ड, ओके, दिस इज डेवलपिंग। So that's it. I think we've completed a lot of PYQs, guys. I will share the PDF in a while. I will be coming up with a revised roster for this coming week, guys. There will be certain changes in the dates. I will let you know. Okay, but all the topics will be covered, so you don't have to worry. But there might be a certain shift days में. टाइम तो 2 PM रहेगा जब भी होगा, बट कभी कभी डेज का चेंज होगा, सो डू फॉलो द रोस्टर, ठीक है। येस दे आर फेयर इनफ, दिस इज फॉर योर प्रैक्टिस एवरी डे. I'll share a compiled PDF of the questions PYQs that were taken yesterday as well as today. I will have a sure shot for Biostat, so there we can discuss Biostat in detail, ठीक है। So thank you so much everybody, have a good day. Obviously if you talk about sputum is lesser costly, ठीक है। All right, thank you, bye bye. Yes, update I'll do. Thank you.